Cannabis use and cultural perceptions. Cannabis has been utilized across various cultures for medicinal, recreational, and spiritual purposes for centuries. Its perception has evolved, influenced by societal norms, legal frameworks, and cultural narratives. In some societies, cannabis use has been normalized due to increasing recognition of its medicinal benefits, while others maintain strict prohibitions based on historical stigma and legal policies. The growing acceptance of cannabis in countries like Canada, Uruguay, and multiple U.S. states reflects a shift in global legalization trends, yet significant cultural divides remain. Political ideology, religious beliefs, and socioeconomic status often shape societal views on cannabis use. Studies show that people from higher income backgrounds may have greater access to medical cannabis programs, with lower socioeconomic individuals more likely to experience legal consequences for cannabis-related offenses. The views on cannabis use are varied. Cannabis use is sometimes viewed differently across generations, with younger individuals more likely to embrace its recreational use, while older generations remain skeptical due to long-standing anti-cannabis rhetoric. Stereotypes surrounding cannabis users have persisted for decades, often portraying them as lazy, unmotivated, or irresponsible. Deeply rooted in historical propaganda, these stereotypes continue to shape public perceptions and policy decisions. The portrayal of cannabis users as stoners in media and popular culture reinforces negative biases, making it more challenging for individuals to seek medical cannabis treatment or openly discuss their usage without fear of judgment. Stigmatization of cannabis use has real-world consequences, including limiting job opportunities, restricting housing access, and discouraging individuals from seeking addiction treatment. Racial disparities play a significant role in how cannabis users are perceived. Studies highlight that Black and Latino individuals in the United States are disproportionately arrested for cannabis possession despite similar usage rates as their white counterparts. Cannabis use varies across demographic groups, with men generally using cannabis at higher rates than women, though this gap is narrowing. Adolescents and young adults are particularly susceptible to cannabis misuse due to the developing brain's heightened sensitivity to THC, the psychoactive component in cannabis. Regular cannabis use during adolescence has been linked to cognitive impairments, lower educational attainment, and increased risk of developing cannabis use disorder (CUD). Cannabis use disorder (CUD) and its addictive potential. Cannabis use disorder (CUD) is a clinically recognized condition in the DSM-5, defined as a problematic pattern of cannabis use leading to significant impairment or distress. The disorder encompasses both psychological dependence and physical withdrawal symptoms, such as irritability, anxiety, sleep disturbances, and cravings upon cessation. While cannabis is often considered less addictive than substances like alcohol or opioids, research suggests that approximately 9% of users may develop dependence, with this risk increasing to 17% among those who begin using cannabis in adolescence. Daily users' dependence rate can reach as high as 25% to 50%. The development of CUD is associated with repeated activation of the brain's reward system, which can lead to compulsive cannabis-seeking behavior despite adverse consequences. Some researchers argue that cannabis addiction may be more psychological than physical, with users becoming dependent on the euphoric and relaxing effects, rather than experiencing severe withdrawal symptoms like those seen in opioid or alcohol withdrawal. However, long-term heavy cannabis use has been linked to cognitive impairments and increased susceptibility to mental health disorders such as anxiety and depression. Treatment for cannabis use disorder typically involves behavioral interventions, as no FDA-approved medications currently exist for managing cannabis addiction. The most effective treatments include cognitive behavioral therapy, CBT. This therapy helps individuals identify and modify thought patterns that contribute to cannabis use. Promoting healthier coping mechanisms, motivational enhancement therapy, MET, a short-term intervention designed to strengthen an individual's motivation to change cannabis use habits. Contingency management, CM, uses positive reinforcement such as incentives to encourage abstinence. Lifestyle interventions, exercise, mindfulness, meditation, and social support have been shown to help individuals reduce their cannabis use. While cannabis withdrawal symptoms are generally mild compared to other substances, some individuals may require medical supervision if they experience severe psychological distress during cessation.